So thank you all for coming tonight. We are going to talk about one of the most exciting topics that at least from my perspective, when we talk about healing, we talk about the spine, there's a magical confluence of nerve system, bones, joints, ligaments, and all that stuff. And when we talk about arthritis, it's just like the holy grail of that. So I thought we'd start with our my favorite the cartoon here. And this is, I can't say I'm entirely pleased with my hip replacement. Isn't that fool? And because here, essentially, if we're not successful at helping you beat this arthritis, the medical doctor is they're more than happy to replace the things that have worn out. Right? There's all sorts of surgeries that are done as a solution. So my job then is to try to save what you got and keep it from having a problem. All right. So what does arthritis mean? Arth is what? Joint. And itis is inflammation. So anytime you see itis, like any of those sorts of things, it's always an inflammation. So the doctor says, I have bursitis. Oh, like that was a wonderful thing. Well, you just got information about bursitis. You don't have a condition. They just said joint. Or arthritis is also one of those things. Now, and patients often are said, oh, my doctor says I have arthritis. Like that is their answer. And it's like, hello. All of us have arthritis, you know what I mean? It's like, come on, that doesn't help us. We've got to figure out what do we do, how do we get through this, and how do we actually make sure that our future looks better than what it would otherwise if we didn't intervene, right? So that's really where we're going. So here's the thing that when patients say, I have arthritis, usually what they mean, in fact, I had a patient talk with me today. He said, well, I used to have arthritis, but I don't anymore. I took this thing, and now I don't. Well, I looked at his x-rays. He's got all sorts of arthritis all the way throughout his neck and his back that I'm working on, right? But in his mind, he was thinking about the arthritis in his hands, right? Because essentially what we feel and what we're aware of is usually what dominates our attention. So it made his hands not hurt so much, so he doesn't think he has arthritis anymore. Well, the reality, he still has extensive degenerate, or he still has extensive arthritis, all right? And the consequence in his body, fortunately, is he's now under more of a wellness type of a care, so he's getting the right type of care for what he just doesn't have a clear understanding. So it was kind of a good thing for me to hear this from my patient today, right before I'm giving this class. So it's a reminder to me, but just so, and they're not arthritis is not necessarily painful, because when you go to your medical doctor and you've got a sore knee, they take an X-ray, oh, you bone on bone, you've got arthritis or something. Well, did you take the other knee? Well, typically not. They just usually take the X-ray, if they even take an X-ray. A lot of times the pronouncement of arthritis will be given without an X-ray, without any, anything like that. It's just that's what the doctor then calls it. And they'll typically then give you an anti-inflammatory or muscle relaxant or something of that nature. And the problem is, if you were to have taken an X-ray of the non-symptomatic knee, there's a fairly high likelihood that there would have been a problem in that knee as well. Now, if that doctor did not know which, I would love to blind these doctors with just say, here's a knee. What do you think this person is hurting or not? And they would look at the ones that have a lot of arthritis and say, oh, of course, those are terrible. This person needs immediate surgery. We've got to do it. Well, the problem is many of those knees that look terrible have zero problems whatsoever in terms of a symptom. So it does not necessarily have to be painful. And the way I found that is people will come into me and let's say your neck is sore. Well, and I take an X-ray of your whole back and I find that there's actually more deterioration in your low back than your neck, but your low back feels fine to you, right? But you may have more extensive arthritis actually in your low back, but you have no symptoms of it, right? So you understand how that makes people, their head cocks back like that. This is almost foreign to them, right? So we're going to think about arthritis. We're going to look at what's actually happening to the joint structures, and then we have to deal with that, whether or not they have symptoms, right? The symptom really is not the best thing to use as their indicator. So, and the medical doctors, they take an X-ray often only of the painful joint, and then point to that area of arthritis, and they'll say, and they usually say the bone on. From my experience, if somebody's about to have a knee replacement surgery or a hip surgery for arthritis, almost always the doctors have used the term is bone on bone. And I'll show you that. I wish they wouldn't use that because it almost gets to the point of inevitability for the patient. They feel, well, there's nothing I can then do. My bone is on bone, so I'm going to hurt forever. I might as well go and have the surgery done and really fix this thing. That's kind of the implied thing. So let's go ahead and dig in. So there are three major types of arthritis, all right? And what I'm doing is I'm saying inflammatory arthritis. And this would be things like rheumatoid arthritis. And have we heard about this one? This is the, and I actually will have a picture of rheumatoid arthritis. That's about 30% of all arthritises. We also have lupus and ankylosing spondylitis. So those would be in the inflammatory category. Okay? So these would be the things that we would think where the body is actually starting to become like an autoimmune or some of those types of things where it's starting to react to itself. There's also metabolic, and this would be the category that we would put gout under with the uric acid crystals and those sorts of things. But the one that I want to focus a lot of our attention on tonight would be this osteoarthritis or the degenerative arthritis. And the scary thing about this is it comprises 50% of all arthritis. But why do you think I get excited about this one?
Because you're getting
This is the one that really tends to respond to chiropractic. And we'll talk a little bit about this. This is one of those mixed things. But what I wanted to do is I wanted to show you some actual x-rays and give you an idea. So when we go and talk about the inflammatory, this is a rheumatoid lupus. Do you see how her fingers, do you see how they're all kind of really, really gnarled? Do you see how these fingers are going way off to the side? I can't even make my fingers go the way those things. And these are the things that are scary. So when people talk about rheumatoid arthritis, I guess to me that's a little scarier in some ways. These are the ones that tend to be crippling than these sorts of things. So although I will say, I've become a little bit skeptical of this as a diagnosis. I sometimes wonder if people are given the diagnosis of rheumatoid arthritis because if they have rheumatoid arthritis, the doctors can prescribe just about any medication without any oversight. It's kind of like a free, get out of jail free for a doctor. They can kind of prescribe anything. To diagnose it, you really have to have your blood taken. You have to have a marker for the rheumatoid arthritis, although they even are allowing the doctors to call a seronegative. That means when they run the blood test, they don't find the marker in the blood, but they're still able to call it rheumatoid arthritis, even though technically you probably shouldn't. So they're kind of acknowledging that they let people have that diagnosis, even though, and I would argue, do they really even have rheumatoid arthritis? And that's, I'm just, this is one of those things that puts me up, and I'm just a little skeptical. In fact, early on in my practice, I had a patient that had been diagnosed with rheumatoid arthritis, but I wonder, I don't think he actually has it, because as I've known him now all our lives, I've known him for 30 years now, and he has zero manifestations whatsoever. He got some adjustments. I think it was all the degenerative arthritis is what it was early on in his life, and they thought that because he was young when he got it, that it had to be rheumatoid arthritis. So I think they then gave him that label. And it was one of the scary things, but it turned out, I think, it appears, in my opinion, it was probably wrong, But so that's, I'll show you. This is an example of what the hands are supposed to look like. Is you can't tell where the fingers go way up. So they're supposed to be able to nice and straight. There should be space in between. So this would be a good hands. I almost wanted to call this the Allstate. You're in good hands with Allstate, right? That sort of thing. But just because you guys aren't used to looking at X-rays, so when I showed that one with the fingers going off to the side, well, what should it look like? Well, they should be nice and aligned, and there should be space in between. Like if we were to take your X-ray, that would. We'd see all sorts of stuff in the knuckles and things like that. Isn't that, it's really something. All right. So this is the other one, the metabolic or the gout. So this would be, there is a predilection on this one for the big toe. So, and this is also, there tends to be an inflammatory component to this. And it's uric acid crystals that get deposited there in the joint space. We don't really even know why. We call this the disease of kings. We know when people eat a lot of rich foods and things like that, it helps contribute to this. But here again, there's not that much you can do about it except for kind of watch what you're eating and don't eat a lot of rich foods and things like that. But I would say if you're under chiropractic care, we really want to encourage people to eat with a more healthy lifestyle anyway. So anyhow. But this is the bad boy here. This is osteoarthritis, what it looks like. So what I use as an example, a side picture of the neck here. And what we're looking at is all this corrosion that's happening in between these discs is the degenerative arthritis. Now, we would say, oh, you have bone spurs in your neck. And the reason we would say that is, can you see how there's this projection that looks like a claw well, I've got some models, and I want to make sure that you understand it's not just, if we look at this thing from the side, you can see the pokiness to it, but it's not just a pokey thorn like